Okay. Hi, my name is Asmida binti Jimis. My metric number is H22A0473. Today, I want to present about introduction TB. Mycobacterium TB, a type of bacteria that most often affect the lungs, but they can also affect another part in the body, as well as is the cause TB. TB both the venation of TB is struck the air. TB can be effect from person to person by sneezing or salivating into the air which spread TB bacteria. Only some number of the microbes must be inhaled to cause infection. It is estimated that around quarter of the world's population is home related of the voodoo, not because TB disease, and some who recover from the infection. Someone cannot spread the disease if they are affected but not yet sick of it. They with the picture on the left is a normal lung, while the right is a lung with TB disease.
Okay,
Okay.
my name. Okay, my
My
name
name
is
is
Amiratu
Amiratu
Husna.
Husna.
My
My
metric
metric
number
number
is
is
H22A0080.
H22A0080.
I want
I
to
want to
present a
present a
normal
normal
function.
function.
Normal
Normal
function
function
is
is
from
from
the
the
atmosphere
atmosphere
is
is
brought
brought
and
and
transparent
transparent
into the
into the
bloodstream
bloodstream
via
via
thrust
thrust
source.
source.
Then
Then
circulate
circulate
to the
to the
rest of
rest
the
of the
body
body
from
from
there.
there.
Then,
Then
the
the
normal
normal
function
function
is the
is the
organ
organ
required
required
help
help
from
from
surrounding
surrounding
structure
structure
into the
into the
body
body
in
in
order.
order.
Then,
Then
its
its
power
power
most
most
of the
of the
words
words
necessary
necessary
in
in
breath,
breath
and
and
more
more
space in
space
the
in the
CVT
CVT
and
and
increase
increase
the
the
lung
lung
capacity to
capacity to
expand.
expand.
And
And
then
then
the
the
lung
lung
are
are
like a
like a
below
below
as
as
they
they
expand,
expand.
they
They
suck
such
in
in
air
air
from
from
their
their
compress.
compress.
The
The
exchange
exchange
carbon
carbon
dioxide
dioxide
waste
waste
in a
in a
push
push
back
back
out
out
during
during
exhalation.
exhalation.
Ex-
Ex-
Exhalation.
exhalation.
Then,
Then
when
when
air
air
enter the
enter the
nose or
nose or
mouth,
mouth,
it
it
travel
travel
down
down
the
the
atmospheric
through
source,
source,
also
also
known
known
as
as
the
the wind
windpipe.
pipe.
And
And
lastly,
lastly,
this
this
ever
ever
decreasing
decreasing
paperwork
paperwork
eventually
eventually
terminates
terminates
in
in
the
the
events
events
which
which
are
are
time
time
as
as
such.
set.
The
The
gas,
gas,
for
for
example,
example,
gas
gas
eating
eating
of course.
occurs.
My name is Amirul Zulaika binti Muhammad Aridin. My metric number is H22800548. I will be presenting about how the disease happen. Tuberculosis or TBs are being spread person to person by microscopic droplets that get released into the air. Even so, TB is contagious, but it's most likely to get from your family members or the person that you live or work with. It's most likely to you to get from the strangers. And also, people who have TBs could be treated with a drug, with the correct drug treatments, and will be treated in the time of 2 weeks. And next, the cause of TB could also from HIV's virus, that is AIDS. Why I would say that it was because uh, HIV virus, that is AIDS, create a immune system for the germs TBs for be spread even more drastically. For example, in 1980s, the HIVs and also TBs cases become much more increased as the HIVs germs AIDS creates a resistance towards the TB's treatments. Third, drug-resistant tuberculosis. TBs have a drug resistant and becoming a major killer. Why? Because if the person who have active TB viruses doesn't get treated properly or doesn't get the drug that they needed and doesn't finish their treatments, the leftover germs could be resistant to its antibiotics. For examples, isoniazid or rifampin. This making the TB cases increase in a drastic way. That's it from me. Next.
Hello, my name is Aifana binti Saidu Muhammad. My matrix number is H22A00185. Not everyone knows that TB is easy for everyone to get infected, especially for young people, the elderly, pregnant women, and traveling abroad, such as in China and Bangladesh. Although TB is spread in a similar way to cold or flu, it is not as contagious. You would have to spend several hours in close contact with an infected person to catch the infection yourself. For example, TB infection usually spread between family members who live in the same house. It would be highly unlikely for you to become infected by sitting next to an infected person on, for instance, a bus or a train. If you reside in, immigrate from, or travel to another country that has high TB rates, for example, Africa, Eastern Europe, Russia, and Latin, it will be easy to people who get affected by TB, especially for people who are having disease like diabetes or HIV. People who have TB outside the lungs or children who have the disease do not spread it because not everyone who has TB is infectious. That's it for me.
Okay, next, tips on how to prevent TB. Okay, my name is Nurmada Shifa binti Rosti. My magic number is H22A 0809. Okay, I will be explaining about tips on how to prevent a TB. Okay, there are many ways to prevent tuberculosis disease. First step is to prevent this disease is getting a BCG vaccine. Okay, this vaccine can be given once in a lifetime. It can be effective. This vaccine, it can be effective for 80%. So, to make sure we can prevent this disease. Next, tuberculosis disease is a airborne infections. This can be released if someone have a disease, cough or sneeze. So the way to prevent is you have to cover up your mouth or nose if you want to sneeze or cough. So for example, you can wear a face mask. Next, you have to have a self quarantines. If you have this disease, this can avoid elderly to get this elderly to who risk get this disease. Okay, last is prevent tuberculosis. We've taken all medications or direct that are directed by doctor. This way is recommended because it will make sure TB germs can be die slowly. So tuberculosis patients is recommended to take medicine as a direct by doctor.
And hi, my name is Engku Ashitul Fakihah binti Engku Alwi, and my metric number is H22A 0990. I will present part of conclusions. TB is a bacterial disease. It mainly affects lungs, but other organs can be affected as well. The most common symptom is TB could be latent or active. People with good immunity are able to fight the bacteria and keep it in the latent stage. If the immunity is weak, bacteria can become active and multiply. Individuals with human immune deficiency virus, chronic disease like diabetes, mellitus, kidney disease, and neoplasma are considered at high risk for developing a TB disease. For this population, it is recommended that they are treated in the latent stage. The treatment of the active disease normally lasts from 6 to 9 months. Hispanic, African American, Asian, and homeless. Thank you. That's all. My gratitude to you for all you have done, which I will never forget. I truly appreciate you and your time you spent helping me in many occasions. Thank you very much for the course. I enjoyed every minute of your lecture, as well as your marvelous sense of humor. Thank you.